Have you seen the headlines that a keto diet is going to increase your risk of heart attacks? As usual, we got to be a little cautious about how we interpret these headlines. I'm Dr. Bret Scher, the director of Metabolic Mind, and this type of thing comes up a lot where we see some sensational headlines that gets a lot of buzz and might get some people kind of concerned about what this means for them. Well, don't worry. In this quick video, I'm going to walk through what we know, what we don't know, and most importantly, how you might be able to frame this to understand what it means for you rather than just reading it as a headline. So first and foremost, what we're talking about is a study that is not published anywhere, right? It's not published. It has not been peer reviewed. It was presented at the American College of Cardiology's annual scientific session together with the World Congress of Cardiology. So it was presented at some meeting, but not published, not actually written down in paper or peer-reviewed. So what I'm going off of is a CNN article. Not exactly the most scientific journals, you could say. But the title of the CNN article is Keto-like diet may be associated with a higher risk of heart disease according to new research. Fascinating title, Keto-like diet. Sort of like being sort of pregnant. Right? And it's a funny analogy, right? But ketosis is a metabolic state. You are in ketosis or you are out of ketosis. There are degrees of ketosis, but there's a clear line whether you are in metabolic ketosis, nutritional ketosis, or other means of achieving ketosis. It's not your sort of keto. And that's the most important part of this whole thing. The diet that they refer to is 25% carbohydrate and 45% fat. So just for reference, if you're eating 2,000 calories a day, 25% carbohydrates is 125 grams of carbs. That's not keto-like. That's got nothing to do with keto. You are not in nutritional ketosis unless you are super thin, exercising a ton, and maybe eating all your calories in one meal. Then you might be in ketosis with 125 grams of carbs. But that is not a ketogenic diet. So right away, crumple it up and throw it in the trash can. Come on, guys. It's a little frustrating. I don't know if it was on purpose or what, but going for the keto headline when really the diet has nothing to do with nutritional ketosis. But we can keep going. I mean, they used a marker of LDL and ApoB, that there was an increase in LDL and ApoB in this population. Okay, well, I'd like to know how high, and I'd like to know what other benefits they got. Because yes, LDL, ApoB, it's something to regard, it's something to pay attention to, not something to ignore, but something to pay attention to in context. So from our perspective here at Metabolic Mind, was this someone who put their psychiatric symptoms into remission and someone who is now leading a quality of life that they've never been able to lead before? Well, in that case, maybe we're going to interpret that LDL increase a little bit differently than if it was somebody who wanted to lose 10 pounds. Not that there's anything wrong with adopting a nutritional approach to lose 10 pounds, but I think you can see the impact on someone's life might be substantially different. So therefore it needs to be interpreted differently. So that's sort of like our unique perspective here at Metabolic Mind. If we're using nutritional ketosis for a medical intervention, there might be some changes that occur for the good and that we need to note that maybe aren't for the good, but then we can balance those together to see what does it mean for an individual. And I think that's such an important perspective because they quote Dr. Christopher Gardner, a researcher at Stanford, in this article, in the CNN article, not the published, not a scientific article, but in the CNN article. And he says, this study provides an important contribution to the scientific literature and suggests the harms outweigh the benefits. How can you say that when you have no idea what the benefits are? You have no idea what the person is using their dietary approach for. So you have no idea what the benefits are. How can you say the harms outweigh the benefits, especially if the harms are a lab value that you have to put into context? So I have a big problem with that quote. And I know journal or public or popular media like this is going to pull quotes out of context, right? So maybe that's not the whole context of what he said. But the way it's phrased on CNN is really problematic to me because we have no idea what the benefits are. And the harms are kind of theoretical, but not to be ignored. And then they quote Dr. David Katz, who, like Dr. Christopher Gardner, is purely plant-based advocate. So they both are coming from a very vegan perspective. But Dr. Katz says, that a low-carb, high-fat diet is associated with adverse effects in the study is reality check for those adopting such diets just because they are in vogue. Just because they are in vogue. Again, completely disregarding the people who are using nutritional ketosis as a medical intervention. And of course, the whole point that this wasn't actually a keto diet. So kind of makes me wonder why I'm still talking about it, because it wasn't a keto diet. But I think it's so important to be able to point out when there's sensational news coverage like this, how it probably does not apply to you as an individual. So if you watching this video are using nutritional ketosis for a medical intervention and you're working with your clinician and it's actually nutritional ketosis and you're in ketosis, this article, this study that I guess was presented at this conference has absolutely nothing to do with you. So I think it can be helpful to say, look, when we see news studies like this, First and foremost, my advice is don't react to it if it's not published and peer reviewed, because you have no idea about the details, right? Maybe the people who are following the higher fat, lower carb diet were much less healthy at baseline, right? That they were using that type of diet for a reason. And were they actually in ketosis? No, most likely not. Like, these are things you need to know from a published study that you're not going to get from CNN or the Daily Mail or whatever type of sensational headline. Okay, so one, I would advise not reacting until it's published. 2, know the definitions. So important to know the definitions. This has nothing to do with nutritional ketosis, but they're throwing the word keto out there, likely to get some attention. But it's just completely inaccurate to refer to this as a keto diet. And 3, know what outcomes they're talking about. Are they talking about people having heart attacks, people dying, or are they talking about a lab abnormality? So those are 2 very different outcomes, obviously, that you need to put into perspective. And 4th, try and take all that and say, what does this mean to me, right? Am I eating a diet that's 25% carbs and 45% fat? Am I doing it because it's in vogue and I just want to lose some weight and, have my lab values change? These are all things that you can check to see if it applies to you. So my guess is for most of you watching this probably doesn't apply to you at all. But I think, look, we can see when this is actually published, and maybe we'll do a follow-up video when it is published. But most importantly is to see things in that framework and understand that, the world is out there for clicks. And it kind of bothers me that people, scientists and researchers and clinicians, people who are sort of noteworthy, are making comments like this about this study when it really should have no application. So I hope that helps clarify things a little bit and helps you put some perspective on it. So, if it was helpful, please click the thumbs up and subscribe, and check out all our other videos here at Metabolic Mind, where we're talking about the intersection of metabolic health and mental health and metabolic therapies as therapies for mental illness. So check out all our other videos and our content to see if that would be helpful for you. All right, thanks a lot, everybody, and we'll see you here next time at Metabolic Mind.